The crisis in Brazil is going from bad to worse. And unlike other countries, the virus is killing many children. Some doctors blame an extreme immune response to the virus, multi-system inflammatory syndrome. Critics point to government mismanagement for the second highest COVID death toll in the world. Doctors Without Borders calls it a humanitarian catastrophe. It says authorities' refusal to adopt evidence-based public health measures has sent far too many to an early grave.
Thalia Gomez starts her day early. She gets up at around 4 a.m, worried about having enough food for her 4 children to have breakfast.
I wake up with a feeling of being in agony. I jump out of bed and the first thing I do is thank God I'm alive. I look at my children and think to myself, today I'll bring home some food for them. I leave the house early to fetch bread. There are days when I can't manage to bring them any, but they run out overnight.
Gomez lives in a favela of around 100,000 people in Sao Paulo. Here and across Brazil, unemployment hit a record high last year. This community association helps people living in marginalized areas to find work.
We had an 84% increase in demand for employment. After the government's emergency aid ended, the number of people seeking our help tripled because so many people didn't have any support anymore.
In December, government aid of around €84 a month was cut, making an already difficult situation for many much worse. The number of people living on less than €36 more than doubled. Many families stopped cooking with gas and started using firewood. 27 million Brazilians live in extreme poverty. Renato Tardelli has been researching the favelas for 20 years. All the data shows that the poorer you are, the higher the rate of infection. The more on the periphery the person finds themselves, the higher the death rate from coronavirus. Brazil has added 2 million more people to the marginalized areas in the past year. It's not ethical that Brazilians have to choose between going hungry or getting the virus. It's unethical. 4 adults live in the home of Silvia de Jesus. She's a cook and the only one still to have a job. But it's just 1 day a week. She used to cook in other people's homes, but they let her go for fear of infection.
This pandemic is difficult. It's going to leave all of us starving. And that's apart from all the damage it does to your health. Look at this queue. We're all in the same boat, though.
With a shortage of vaccines and hospitals overwhelmed, it's hard to see a way forward for people in the lowest social groups who are trapped by both poverty and disease.
So life's become even more of a struggle for many Brazilians. Maini Nicolai is from Doctors Without Borders. Just how catastrophic is the situation in Brazil?
Yeah, the situation is really bad. So the MSF teams are working worldwide in 70 countries. We have supported health facilities in the response to COVID. And in the beginning, it was difficult everywhere. What we see now, a year after that, the situation is still very, very catastrophic in Brazil. And our teams, together with the staff on the ground, is overloaded with patients. They don't have, for instance, the drugs to intubate people, to give them the right anesthesia. So we have images where nurses are sitting on the ground next to people dying because they don't have enough beds, they don't have enough oxygen, they don't have enough medicines to treat the people properly. So it puts an immense pressure on the whole healthcare system, but especially on the staff as well. And people are dying. The numbers that we have of deaths every day is unprecedented.
Let's just run through some of those numbers, Maini, because out of a population of 211 million, there are about 14 million official cases, close to 66,000 confirmed infections every day. And to put it into perspective, the death toll globally has passed 3 million. Over 500,000 of those in the US, in Brazil, about 375,000. Why such a poor record?
Yeah, well, this is the right question, and you've put the numbers on the screen. So this is exactly why we have taken the microphone to speak out about this, because there's no coordinated response. We don't stop this pandemic in the intensive care units. You have to have actions in the population. As we all know in Europe and elsewhere, that we have to do things, not only vaccinate, but we have to put measures like wearing masks, keeping physical distance, reduce non-essential mobility, do testing and contact tracing. All these things are not done in a coordinated way in Brazil, and the health authorities are not putting themselves behind this. And it's scientific, it's knowledge that we have constructed over the last year, and it's not being implemented and used.
Is Brazil's leader at fault here in this case?
Well, we are not pointing at one individual. It's the authorities. It's the federal government and it's the health authorities. Local governments, we work very well on local level, and the people there are overloaded as well. They're crying out for help. We need a plan. We need a good plan that is implemented, and we're not asking for very complicated issues. It is common knowledge nowadays that you need a package of elements to implement those to try to stop the transmission. Look at the numbers you put on the screen every day, the number of people that are getting infected, and the health structures cannot cope. In a country as Brazil, because Brazil is not one of the poorest countries in the world, it has a very good system in place normally, but it's collapsing.
What's your explanation then for COVID killing so many young Brazilians, including babies?
Yeah, we don't have a good explanation for that. So we're also looking into this together with other scientists. What exactly is it that makes it? Of course, there are new forms of the virus in Brazil as well. So we have new mutants of the virus. If you don't have a collective response that we're asking for, we see here the funerals. There is a collapse of places to bury people. It's horrible. If you speak to Brazilians, everybody has somebody that has died or is being intubated. But the point of the children, we cannot yet completely explain. There are new mutants. If you don't have a collective response, you give the virus the possibility to create, to escape the system and to survive. But the new mutants do not just explain the situation. If we compare it to Southern Africa, for instance, where we also have new mutants, they have vaccinated less people proportionally than in Brazil, but they are reducing their peak because they've put other measures in place. So the mutants don't explain the situation in Brazil, and we need a public health plan.
Really briefly, this multi-system inflammatory syndrome, or MIS, which is being blamed for some of these deaths amongst children, is that what could be the main cause?
Yeah, this is something, this is not for us to comment on as Doctors Without Borders. This is very technical. The right researchers have to look into this. I wouldn't like to make any, hypothesis and estimations on it. It's dreadful that young children drive the disease as well in Brazil. The whole population is suffering. All families are. And what we are calling for is stop the disease in the communities by doing the right things. And we know what we need to do.
We'll have to leave it there. Maini Nicolai from Doctors Without Borders. Great to have you on the show today.
Thank you.
Over to our science correspondent, Derek Williams, who has a viewer question about the European Union's vaccination effort.
Why is the EU lagging behind in the race to vaccinate?
This isn't really a science question, but people here in Europe have asked it so often in the last few months that I wanted to talk about it for a minute. First of all, I think it's important to say that compared with a lot of the rest of the world, EU member states aren't lagging behind. At the moment, its countries have, on average, injected over 20 doses per 100 people and are currently inoculating over 2 million people a day. The global vaccination campaign has certainly certainly chugged along faster in some places, notably Israel and the US and the UK. But even so, in many, many other places, the numbers of vaccinated are growing at a much slower pace. Still, there's no question the EU stumbled pretty badly out of the blocks in its vaccine campaign, and that mistakes were made that will cost a lot of European lives. Critics say one of the biggest is what at the time last summer was viewed as a strength, which is that the EU, negotiating as a bloc, drove hard bargains with manufacturers, but then neglected to get the ironclad agreements on delivery. And the result was that in the first quarter of 2021, only a little over half of the contracted doses were delivered. The EMA has also been slower to authorize some vaccines than its counterparts elsewhere. And vaccine distribution has proven problematic in different ways, both at the EU level and in individual member states. But there are hopes that the bloc is now turning a corner of sorts. And many leaders say they still expect to meet the goal of vaccinating 70% of the adults in Europe by this summer.
Finally, this could win over some vaccine skeptics. Joints for jabs. New York recently legalized marijuana, so longtime activist Dana Beal set up a booth in Union Square, handing out blunts to anyone who showed their COVID-19 vaccination card. Hundreds came. The giveaway ended with a smoke-in. Nice to finish on a high point. Thanks for watching.